Experts Medical. Сегодня мы в гостях у нашего самого любимого доктора Эрджана, который специализируется на груди и на лифтинге. Он делает действительно очень классную работу, поэтому мы с удовольствием и спокойным сердцем отправляем к нему пациентов. И сегодня хотим познакомить вас с ним. About breast augmentation. What kind of technique do you use and how you choose? Does the patient requires lifting or doesn't requires? And what approach you will use under the muscle or from the side?
There are, certain established rules of plastic surgery. If we start with, for example, breast augmentation, it's obvious. We have to check how the breast looks. For example, how the breast, is there any sagging or not? Mm-hmm. If there's no sagging, definitely there's no need for lifting. But if there is sagging of the nipple areola, so we have to, sometimes, not as a rule, but in the majority of cases, we have to combine breast augmentation with lifting. So we are asking our patients to send us picture, front and side view, so we can see how the nipple looking according to the IMF. So based on this relationship, we can decide if just augmentation needed or plus lifting needed. And then in the majority of the cases, almost 95%, I prefer to place the implant under the muscle because it gives more permanent, long-lasting, good results compared to the above the muscle. I am a big fan of under the muscle, placer. In the majority, as I said, almost 95% of the cases. And number 3, in this series, we have to decide where I have to place the incision around areola, under the breast, or near the armpit. And it is mostly thing I discuss with my patients based on their expectations. But in the majority of cases, under the breast area is less visible. But some patients prefer around areola. That's fine. I can do it. I keep asking my patients if their preferences. I always follow their preferences, and I tell the pros and cons. We make a little discussion about that. What is the pros and cons about placing in this particular area, and then we get an idea which is going to be the optimum result for her.
I see. And actually, what kind of form for the implants do you use and why?
It's also dependent on patients. Some patients, if they have a drooling in the upper pole of the breast, which means atrophy, in this case, it will be better to use a round implant. And round implant is also an advantage for long term because there's no risk of malposition of implants. Because, as you know, for the anatomic implants, they have to be in a certain situation. You cannot, if they change the position, there will be a weird appearance. If this is the key, if this is the issue, so we have to choose round implant. But there are some minor cases of patients that because of their chest anatomy, which is chest looking, we might have to choose anatomic implants. So again, based on the chest cage features, we try anatomic or the round.
Is there any risk of ptosis of the breast after the surgery? I mean, if we do lifting, maybe not enough, or doesn't do lifting, is there any risk that the breast go down?
If you judge your patient before the surgery exactly, there is very low risk of having this problem. But yes, there is literally, I will say 5%. There is maybe suboptimal lifting. You may need to do after 4 months, 6 months, I would say, because even after surgery, a couple of months, it might be a little require. We need some time for fully getting results. Let's say after 4 months, if still there is a sagging of the breast, yes, it can be done. But in the majority of cases, I will say almost 95% of cases, there is no need to do another lifting. We do very satisfactorily without any problem. But 5%, we may need to do some revision of the lifting. And if you need to, it's very simple procedure compared to the first one, because it's just changing the soft tissues. You don't have to change the implant or other stuff.
And if it happens, will it be on charge of the patient or?
Just the patient, basic hospital fees, not extra doctor fee. No.
I see. And about the pain, will the patient experience pain after the surgery, and how long it will last?
If you are placing an implant under the muscle, there is always a risk of pain, but I am doing some kind of pain relief procedures before surgery. I am using some kind of medicine before the surgery, just when the patient is in full anesthesia. In the beginning of surgery, I make numb the nerves, so it gives me much room to control the pain of the surgery. So my patients are not really, it's not an annoying issue for my patients after surgery. And then 3 days after surgery, there's some tension, but we can easily control it with pain management, with pain tablets or injectables.
I see. And the full recovery is when the patient doesn't feel any disruption after the surgery?
I would say almost 80% of this tension-related pain goes 3 days after surgery, and I would say 1 week after surgery is almost none. But still, we are asking our patients to control their arm movements within the first 3 weeks. We don't want them to move aggressively within the first 3 weeks after surgery. But on the other hand, 10 days after surgery, they can start driving, and almost 3 weeks, 1 month after, they can start swimming, but not with aggressive arm movement. They have to be careful within the first month.
And when they can come back to work after the surgery?
3 days after, mostly.
3 days after? I mean, they are staying in Istanbul 6 days, so after they come back, they can go back to work.
Almost, yeah. We are just asking them not to do too much arm movement, not aggressive arm movements. They can, as I said, 10 days after they can start driving, and then 1 month after they can do many exercises. Also, I have to tell that almost 10 days after, 3 weeks after, they can start running without any problem.
Okay, and talking about unpleasant but scary things, what kind of complications we could say face with breast augmentation and with lifting, and what happens with your patients who come from abroad and face this complication in case it happens?
Every surgery carries some risks. Literally, we have some bleeding problems, wound problems, infections, but these are almost the good thing. Thanks God, we are not seeing those. Very, very seldom. I will say 1 in 200 cases, 1 in, I will say, 500 cases. Mostly, the complication cases, mostly the patients have some problem, maybe high blood pressure, some blood problems, some maybe this kind of things, but normally we don't see it. So I will say 99% of patients have their surgeries and they went back to their home country without any problem. And we keep following them with the media, with social media, and we control everything. But let's say for some reason happened, so this is the place we are waiting them. If something happens, they can always come. We can manage them. Even they are not going to be something in emergency. Let's say there are some scar problems. They have some scar healing problems. They can also do it in their home country. But as I said, in 99% of cases, we are not seeing these kind of things.
Okay. So how is it possible to come to make surgery?
With your help, we get a good pre-surgery exam. So, we are doing this video consultation with the patients. And after surgery, also, they can contact with you if they have any question or other stuff. Also, they contact with you about hotel transfers and other stuff. it's easy. Just making you a phone call. I think everything will be easy through you.
Correct. We are always happy to help our patients. Yeah. Thank you very much for such interesting talk, Dr. Erkan. And hope to meet our patients in Istanbul to help them.
We
thank you very much.
Forward to see that.
Yeah, thank you.